Previously on SA Health Icon.
When you were doing internship, you were actually planning
To be a GP.
to be a GP.
Yes, for 5 years in Victoria. And he said, is there medical school for black people in Atteridgeville? I said, no. You see,
Yeah.
then the prayer time came, obstetrics and gynae.
Yes. That is in your final exam.
Yes, the second was these fellows had traveled all the way from the Transvaal. And they got to the medical school. This fellow gave them 5 minutes. They'd come to us, can't you increase the quota
Yes.
of intake of a school that was primarily built for us, they said.
Yeah.
And this fellow said, you can't teach a graduate from Bantu education medicine.
This is years later.
That stage, I mean,
Yeah.
we're talking about
Early
74, 73, 74, that's late. We've been producing doctors from Bantu education.
From
And-
1951.
We were producing doctors from Bantu education, and this fellow gave them 5 minutes and said, you go and talk to government to stop giving you Bantu education because we can't teach Bantu education students medicine. These fellows left. I know they told them that because they met me immediately. I was there as a teacher and said, this is what your dean says. And they left. And they went to see Minister of Education and of Bantu Education and Development and said, look, we want our medical school. That one is no more our medical school. They went to ask for it. It was black people who asked for Medunsa to be there. It wasn't the white government.
Yes.
No. So this is when it started. And that, I forget his name, he was a very powerful man in the Nationalist Party. And he went ahead and granted this and said this must happen. Yeah, because all right, it's right from what's happening in the other medical schools, there are no spaces enough for black people. But you see, the only wrong thing is that once they thought of doing that, they said, now you can't go to the other medical school.
Yeah.
That's what made. But their decision at the right time, I find it difficult to fault. I can't fault it at all.
Yeah.
But it's when they said, now if you do this medical school, you can't go to the other medical. That was wrong.
Yes.
That I fault.
Yes. Yeah.
And so this is how it came about. So, as I said, these old men who were, to me, were my mentors. And I say it publicly, these were highly educated African people. And I kept knowing what they were trying to do. So they went out, they got this medical school to be started, and they came and asked me that, look, you must be part of it. But I didn't make up my mind immediately. I thought politically it was a dangerous thing to do, and so on, because of this other part that...
Once you have your own, then you
Yes.
can't go to others.
Yes.
Just to get this thing clear, the setting up of Medunsa as an institution was not as a result of the broader segregation thing. If anything, it was something that was initiated by black educationists who were advisors to the ministry then of Bantu education.
And it happened of what they thought is needed.
Yes.
Certainly in healthcare and provision of manpower for healthcare.
Yes.
Because the numbers that were produced were getting even smaller.
Because the other groupings within the broader black grouping were getting to occupy a bigger percentage
Yes.
of the pie.
That's
and
right.
so they were looking at a solution around how do you then increase the outputs, because the demand for medical doctors was greatest in the poorest areas
Yes.
of our country.
No, that's true.
Yes.
Yes.
Okay. Then obviously, during that time, there were those from a political point or other points were not so supportive of that institution, because they thought it was part of the grand scheme, which obviously you've corrected us to say it was not.
No.
What kind of things, kind of resistance that you experienced, around that, because I want to ask, at what point did you show an interest then that you want to be one of the people who will make sure that you birth that university?
Well, I talked to many people about it, especially these leaders of educationists.
Yeah.
About it. It became very clear that it is a fact. We're producing less and less Africans into medicine.
Yes.
And that was a fact. And it's also a fact that the need for African doctors was large, as it still is even today. It's very large. And thirdly, that this medical school will start, if it starts, my first priority was to make sure that the curriculum is right. And that was the first thing I wanted to do, and I was engaged with as I got to Medunsa.
Was that informed by gaps that you had picked up during your time in Natal, or certain ideas that you had that if you had an opportunity to rewrite the curriculum, you would maybe have a different approach to things?
First, I think the curriculum, when I got there, the curriculum they first had was inferior.
Yes.
And the first thing is that they must do and be taught as all medical schools are done.
Yeah.
And they must fall within the health professions body and be examined with the rest, so that our curriculum had to be the same that the Medical and Dental Board of Council of the country needed. And that me and many of my colleagues, and I was the seniorest of them all, we managed to change.
Yes. Let's go back a little bit, Prof, so that we will get to this point. I'm just looking at your decision making, because you mentioned that it took you a bit of time to actually submit the application.
Yes,
and
I did because at the time I had to weigh what my students in Natal felt. My students in Natal were totally, remember I was Dean of Students, were totally against it. And I had to weigh this against what is reality, what needs to be done.
Yes.
And that's what delayed me a bit.
What was the issue with these students? Because I also know that there was a representation that they made to you, the SRC at the time, in Natal.
They did, and they wanted me to resign because they didn't want to have me as their dean if I was going to go to that medical school. It's a thing that was resolved easy because I said I wasn't appointed by students. I was appointed by the university. I will tell the university, and I duly told the university officially the need of the student. The university said they've considered it. They think I must remain dean until I leave for the new medical school, which I did.
Yes. Your colleagues, your Prof Marivate, Prof Pitwe, and Shwene, and others, your contemporaries who were with you in Natal, what was their take on you now, basically going to set up a new university?
I think all of them didn't think it's wrong. They didn't all want to come with me.
Yeah.
But as face to face, all of them said it's the right thing.
Yes.
Marivate, right from the beginning, as he did ultimately come up, was not against it.
Yeah.
But none of the other two opposed it.
Yeah.
They didn't think they would change and go there.
Yes.
That's all.
Yes. So in a way, they did support it, but personally, for their own reasons, they were not necessarily
Going to move.
Gonna move.
Yes.
Yes. Yeah. Okay. And at that time, you were, I think, were you working with Prof Philpott?
Yes, I was under Philpott.
Yes.
I was his deputy number 2.
Yes, yes. And how did he view your decision there to then move from Natal,
I don't think he openly opposed it.
Yeah.
Yet I know he was, from the writings he made to the to Lancet Journal, he was opposed to it.
Yes. But he never,
He never
told
said,
you.
he told not to go.
Yes.
No.
Yes. All right. So the students did not win, and then you were appointed that you were going to start, I think, in the middle of
The medical school started January 1978.
yes.
Other professors started then.
Yes.
But because of academic reasons, I delayed and started 1st July of 1978.
So about 6 months after the medical school had opened.
Yes.
Can we just quickly talk about that? I understand you were finalizing or polishing up your PhD thesis at the time.
That's
and
right.
so you wanted that extra 6 months to make sure that by the time you take this new responsibility, you're done with your PhD.
Yes, just to make sure he handed in and it's a finished thing. Then I finished that studying with Natal at the time.
Yes. And so you did submit your thesis. Was it 77, 78?
Well, it at latest must have been 78.
Yes.
But as I left in 78, must have been 77.
Yes, yes.
I remember I gave it in before I left.
Yes.
So it was in 77.
Yes, and I won't go into detail about things, but it took some time before you actually got to be given that thing that you now have your PhD.
As you can see with what I've said before,
Yes.
I got my MD in 1980. That's almost 3 years later.
Yes. Yet you had submitted your stuff
77.
3 years before. Yeah.
Yes.
All right. But anyway, the good thing is that you eventually got your MD, or PhD degree, and you were, researching clinical and biochemical features of pregnant diabetics. So that says it was an area of interest for you. That's an area that you brought new knowledge, was in PhD.
That's right.
It's about bringing, is to growing the knowledge base, bringing something new
That's
that
right.
wasn't there in the field before. So what did you bring out of your study, Prof, that was new to the medical field, never been done before?
Well, I think, I wouldn't say completely not done before, but I think it clearly showed there was differences on racial basis. For instance, the glucose tolerance test.
Yes.
It evidently showed that. And that went into the management of the two groups.
Yes.
For instance, because this was a study between black Negroid, if you like,
Yes.
or Zulu, the women versus Indian women.
Yes.
And it all started from that. It started from normal, non-pregnant ones.
Yes.
And we looked at those things, and this gave the insight into the management, for instance, the dietary needs and how they should be worked out.
Yes.
To meet the levels that are, or the norms that are accepted in the management of the disease.
Yes. And out of that, what impact did it then have, locally and maybe globally on how people must be managed? That is, pregnant women from different race groups, the ones that you researched?
I think those who are doing the right thing should follow that, because
Yes.
it's not quite the same. For instance, you
Yes.
take the glucose tolerance test of the black people tends to be flat.
Yeah.
You see, whereas the Indians and whites, it takes a very sharp turn.
Yes.
They have a very flat thing.
Yes.
So people must be careful how they interpret it.
Yes.
So you must look at those type of things. If you treat them on what is in textbook at the time,
Yeah.
you'd make a mistake.
Yes, yes. So it did change how those groups of people were managed.
I believe
Yes.
it must have.
Yes. And was this work published, in those big recognized journals or
Well,
anything like that?
I think
peer-reviewed stuff?
I think I published once on it.
Yeah.
But the book is there with the university. If anybody wants to see it, it must be there for reference.
Yes.
It should be there in all.
Was it Natal or?
It was Natal, of course.
Okay.
It was Natal.
All right.
But it should be there in any library that's serious. I mean, it's something on management of patient. They should have them there.
Lovely, Prof. But I also know then that you were not just interested in that area. Another area of interest for you was around, septicemic shock. Septicemic shock. That is, people getting into shock as a result of the body being overwhelmed by an infection. Yes. Can you just talk to us just about that interest as well?
Well, this one actually is the oldest one. When I first became anything to think about in ONGs, we found that septic abortion was killing lots of young women in Natal.
Yes.
And Professor Derek Crichton wanted us to get on top of this problem.
Yeah.
And that's when I started studying it. It's what causes it, and we find mainly septicemic shock that caused it, and why would we fail to treat septicemic shock? And we looked into first the pathophysiology of septicemic shock. That it should be, treatment must be arranged in such a way as to meet the pathophysiology. One of the things is that the infection overwhelms the systems of the body, so that the response of the cardiovascular system is blunted. And to do that, we needed a more sensitive way, and we made popular that time the use of the IVP monitor, so that we replace fluid, and that the idea is to keep very large fluid run and to blunt the sepsis with the use of large doses of corticosteroids and keep it that way. And of course, I mean, the other thing would be the surgical interventions to make sure to use evacuation quickly and where necessary to remove the septic organs altogether. So that's what that particular interest.
And even in that area, it's an area that you published quite a lot in.
Yes, I published a few things there.
And in any other area within now broad, ONG, other areas that you contributed in?
Well, I've been around. I did quite a bit of work on the diabetes I've talked about. I did a lot about ruptured uterus. I did that. In fact, at one stage, our study with the late Marivat was the largest ever published. And I think the principles still hold today. And I think that made a big change in the approach to treating ruptured uterus today.
Lovely, Prof. So let's get to then your time now at Medunsa. You joined June, July of 1978 as the new boss. I'll call it that way. You were the principal or the vice chancellor.
No, I joined as head of obstetrics and gynecology in 1978.
I got it wrong. My apologies.
As head, there were five professors who started Medunsa. And of course started Harankua Hospital as a tertiary hospital with the five of us. I was the only black one, of course. And when I started there were actually two black doctors working. The one is the present-day retired Professor Mariva. He was an intern, he was a medical intern, and we used to jog together after work every day. So we started that way. But it was a time where I was tense. I was tense because first, it's the first time I was now official professor. And I was opening a new institution. And all the doctors under me were white.
Yes.
Now, and I am so grateful to these fellows. I have not had any better support than those groups. And wherever they are, if they read this,
Yeah.
they still remain my heroes. They supported what I wanted to create at Medunsa and supported it without any sign of breaking down at all. In fact, the first 5 gynecologists I produced at Medunsa were white. The first black became number 6 in that line. Though later, of course, it predominantly became black, but they always had white registrars.
Yes, and you worked very well with them.
Very well,
Yes.
very well. I mean, I still meet men. I think 2 I know passed away, but some I still meet at the Congress.
Yeah.
They take me away, they entertain me. They're the greatest friends I've ever had.
Yes, yes, yes.
Yeah, so I don't think South Africa can work. I think
Yes.
it's just nonsense.
Yeah, it's just a mindset.
It's mindset.
Mindset that
That's
needs
right.
to shift. Yeah.
Yeah, yeah.
So Medunsa was not just for medical students; it was for other health professions as
Yes,
well, like dentistry.
We had dentistry, we had veterinary school as well.
Yeah.
The veterinary school was shut by ANC after the return to power.
Was that a wise thing to do?
No, it wasn't a wise thing.
Because right now, South Africa has got a serious shortage of veterinary surgeons. I mean, the few that are getting trained, is it under something?
Honor support.
Yes, under support.
Now, our farm, original farm,
Yeah.
even the farm that I ran as vice chancellor, was very, very close to honor support.
Yeah.
Now, I'm just telling you this way. When the debate came, as ANC decided they want 1 veterinary school in the country.
Why?
They've never given I don't think they can give a good scientific reason. There's a political reason, and I never knew where it is because I opposed it from the beginning.
Yeah.
I think even Pretoria University opposed the idea of 1 veterinary school. It was never really accepted by...
I mean, I would expect that in a country that had a low number of veterinary outputs, you would then actually work towards increasing, allow that which is there and actually increase the outputs.
That's right. And our curriculums were different. Ours was more production animal based. And Pretoria one still is what we call companion animal based. Not that they don't have production animal, but it's based that way. Ours was very light on companion animals. And when they wanted to close, my argument was, when you come to think of this democracy and you're going to open up farming to all races equally, or as far as possible, then you would need to have veterinary science to help the developing black farmers.
Yeah.
And the reason we are having this curriculum, we had that in mind.
Yeah.
And we want to continue producing that. And at the time, we were producing 25 or so veterinarians a year. Now, if you take in terms of black, let's come to this color thing I don't like in this country. If you come to that, they are producing far less than that in Pretoria now. And I told him, I said, this is going to happen. Once you mix them, that's going to happen. There's going to be less and less of this, and you need these ones being where they come from, the ones to come and to go and do the job there. But that they did. I mean, they themselves, I wish they see this type of thing and they can read and tell the world why they closed the veterinary school. But anyway, and the other thing I said, if you want 1 veterinary school, and there's only 1 health sciences institution in this country, and that's Medunsa, then take the veterinary school out of Pretoria University, which is a general university, and give it to Medunsa.
On next week's episode on SA Health
Number of
Icon.
incidences of strikes and boycotts is in my time. That formed the Health Professions Council.
Yes.
And then I was in the new one for 5 years after that, and then I came off. I would have felt even better if my alma mater gave me one, but it hasn't.
Yes, which is Natal.
Yes, it hasn't.